Student making my NG suctioning tube video. And I'm going to run through my supplies. I have gloves and hand sanitizer, airway lubricant, tape, measuring tape, a pH measuring kit, my NG suctioning tube with the Y port, and the clamp that goes along with that, syringe, sterile saline, and a cup for the patient to use as well as a paper towel and an emesis basin and a waterproof pad. So I'm going to start my procedure. So I'd knock and introduce myself. Hi, I'm Macie, and I'm going to be your nurse today, and we're going to be inserting your NG suctioning tube. I would sanitize and identify the patient. Could you verify your name and date of birth for me? And verify it on the wristband. And I'm also going to verify the procedure with the medical orders. And then the patient has reported normal vital signs, so I'm going to assess the stomach. And I'm going to listen before I palpate. So that I don't disturb the stomach. I'm going to lift them up to my level so that I'm not bending over and hurting my back. And I also have provided privacy for the patient. I'm going to listen in 4 quadrants. And then I'm going to palpate for tenderness or hardness or stiffness. Do you feel any pressure? Does anything hurt? Okay. And then I'm going to elevate the patient to a high Fowler position. I'm going to get the patient ready with a waterproof pad on top of the chest so that I don't get the patient wet. That no contents spill onto the patient's gown. I give them an emesis basin and a cup of water with a straw so that they can swallow as the tube's going down, and as well as a tissue to wipe up anything. Okay. I'm going to explain the procedure to the patient. So we're going to be inserting an NG tube, and this is going to go in through your nose and down into your stomach. It's going to be a little bit uncomfortable, but it shouldn't be painful. At the beginning of this procedure, you'll lean your head back, and when you feel yourself start to gag, you'll tuck your chin to your chest. And then you'll start swallowing that water so that it'll help the tube go down. Okay, so now I'm going to put on my gloves and start to get my supplies ready. And we only have to use clean gloves. We don't need sterile gloves. This is just a clean procedure. So I have my tube, and I'm going to measure from the nares to the earlobe, and then from the earlobe to the xiphoid process. And I'm going to mark that point with tape, so I know how far to insert the tube. Okay, and now I'm going to lubricate the tip of the tube. Alright, and now I'm going to insert the tube. I'm going to have it go along the back of the throat so that we don't enter the lungs. Okay. And now lean your head back, take some slow, steady breaths. I'm going to advance it slowly. And when the patient begins to gag, I'm going to have them tuck the chin to the chest and begin swallowing the water. Okay, and now I'm at the measured point, so I'm going to put some temporary tape on the nose to secure the tube. Okay, and at this point I'm going to aspirate the contents to make sure I'm in the stomach. I'm observing the stomach contents for color and consistency. If it's a straw-like or yellow color, that's pretty average. It could also be bloody or a green grass-like color. So at this point, I could also check the pH of the stomach contents by using my pH paper. Or I could order an x-ray to verify that the tube is inside of the stomach. And now I can remit the stomach contents or whatever the hospital procedures follow. And so once I have verified that I am in the stomach, I can remove the syringe and clamp the tube. And I could use a rubber band and a paper clip to secure the tube to the patient's gown. I would want the vent to be above the stomach. But we're going to go ahead and go on with the suctioning. So I have this port, and it's going to help connect our tube to the suctioning tube. I'll connect these and put it on intermittent, and I'm going to turn on the vacuum. I'm going to also secure this to the gown. Okay. And at this point, you would make sure to perform oral hygiene 2 to 4 hours. And after inserting the tube, you want to go ahead and offer that oral hygiene and go ahead and clean up the patient.
I'll leave this.
And after the procedure, I would document the size of the tube used, the color and consistency of the stomach contents, and that the tube placement was verified and that it was left on suction. Okay. And once I have the patient cleaned up and returned to a comfortable position, and make sure that the bedside table is nearby along with the trash can and their call light, as well as their phone. Okay. And that is it. And I will sanitize as I walk out and provide privacy.